Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, in this occasion I want to present a presentation about GAD or Generalized Anxiety Disorder. In this occasion I want to tell you about what is GAD and what are the symptoms of GAD and what is the causes and risk factors of GAD, also how is GAD diagnosed, and the last but not least is how is GAD treated. So we go to the first section, that is what is GAD. GAD or Generalized Anxiety Disorder, characterized by persistent or excessive worry about a number of different things. People who have GAD or Generalized Anxiety Disorder worry uncontrollably about common occurrences and situations. It's also sometimes known as chronic anxiety neurosis. You have got a huge presentation in front of your college. You're nervous. You've got quite a bit of stress leading up to the presentation. The stress is completely normal and really probably useful in certain situations, since it can make you more alert and careful. After the presentation is over, you feel this stress start to fade away, right? Well, for 3% of the population, the stress doesn't go away, and maybe the stress isn't even brought on by a specific event, and it's just always sort of always there. Either way, at this point, it's considered to be anxiety. The anxiety might even get worse over time and causes things like chest pains or nightmares. Sometimes the anxiety is so severe that it causes someone to be anxious about leaving the house or going to schools. So the anxiety might be a sign of Generalized Anxiety Disorder, sometimes shortened to GAD. GAD is characterized by excessive, persistent, and unreasonable anxiety about everyday things like money, family, work, and relationships. Even sometimes, the thought of getting through the days causes anxiety and worry. If the anxiety is persistent, then it doesn't seem to go away. If it's excessive, it's usually more than someone else might feel. And if it's unreasonable, they probably shouldn't have a reason to feel anxious about it. People who have GAD might even understand that their anxieties are excessive and unreasonable, but they feel it's out of their control and don't quite know how to stop it. People with severe GAD might be completely debilitated and have trouble with the simplest daily activities, or they might be only mildly affected and be able to function socially and hold on a job. Sometimes the feelings might worsen or improve over time. In addition to having feelings or worries and anxiety, other symptoms include edginess, restlessness, difficulty concentrating, or feel like the mind just goes blank, and also irritability. These physical symptoms can also lead to physical manifestations of symptoms like digestive problems from eating more or eating less. Finally, they might also have muscle aches and soreness from carrying tension in their muscles. Finally, difficulty sleeping is a really common symptom that can have a serious impact on physical well-being, since the body is not resting and can lead to issues of chronic fatigue. Although the decision that someone's worry is excessive and unreasonable has a subjective quality, diagnostic GAD is aided by Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. This manual gives a list of criteria to meet in order to be diagnosed with GAD. First, the excessive worry and anxiety has to have been present for more days than not over the course of 6 months. In other words, a person should have the symptoms of excess or unreasonable worry on 19 or more days out of 180 days. Generally, people can quantify or track their feelings in this way. So again, this is meant to offer a general guideline, right? Okay, second, the person finds it hard to control their anxiety, meaning that they have a hard time calming themselves or self-soothing to help themselves regain control over their feelings. Third, an adult must have 3 or more of the symptoms listed previously. In children though, typically defined as school age, so between 6 and 18 years old, only one symptom is needed for the diagnosis of GAD. Another criteria is that the anxiety causes impairment in important daily activities like school or work. For example, they might miss their deadlines or find it difficult to even go to work because of their symptoms. If the symptoms are not attributable to their physiologic effects of a drug or medication, or due to a medical condition like hyperthyroidism, which creates an excess of thyroid hormone, which can sometimes cause symptoms of anxiety and worry. Finally, their anxiety isn't better explained by another mental disorder like social phobia or panic disorder. Just like a lot of mental disorders, it's unclear exactly why some individuals develop generalized anxiety disorder. But it is thought to be a combination of genetic and environmental factors, as it seems to run in families. It also has been shown to be twice as prevalent in females than in males. Treating GAD, like many mental disorders, may involve physical therapy, medication, or a combination of the two. If it is physical therapy, cognitive behavior therapy has been effective since it teaches the patient to think and behave in different ways and react differently to the situation that would usually cause anxiety and worry. Medication like benzodiazepines or antidepressants may be prescribed as well. Medications like benzodiazepines or antidepressants may be prescribed as well. Benzodiazepines are a type of psychoactive drug that have relaxing and calming effects. Antidepressants might also be prescribed, like selective serotonin reuptake inhibitors or SSRIs, which regulate the serotonin levels in the brain and help elevate the mood. Even though both medications and cognitive behavior therapy have similar effectiveness in the short term, cognitive behavior therapy has major advantages over medication in the long term due to unwanted effect of the medication like tolerance dependence, and withdrawal.